So during the last review, I covered the unit conversions. So going from metric to metric, then we talked about going from metric to household. The next style of question, and then after we did that, we kind of carried on and we talked about, and I think I was working on a different sheet, but it's the same problems. And then I talked about the calculating fluid intake. One of the things we talked about last week was just you do need to know what is the what are liquids or what could be liquids, like Jello. You might think of as a solid, but if you've ever made Jello, you know that it's predominantly water. It's just congealed. Now you would say Jello is a liquid, but I would argue, and you could argue, I think pretty well, that pudding would not be considered a liquid. And if you've ever made pudding, it's actually less volume or less water added to that, less milk or whatever they put in there. I don't think I've made pudding before, but so it's kind of like, if you've ever made like a cake, you add a little bit of water or milk or something to those things, but it's not predominantly the thing that's in there. The predominant thing is the solid. So anyways, just something to keep in mind. Turkey sandwich, even if it tells you it's a 4-ounce turkey sandwich, that 4 ounces is referring to the weight of the turkey sandwich. It's not referring to the volume of the turkey sandwich. And then you would just convert all the liquid volumes into milliliters, and then that would give you your total fluid intake. So what I want to do now is I want to practice some of these problems that are associated with looking at labels and deciphering what you are administering to your patient. And I just want to pull up the blueprint real quick just to kind of refresh my mind on a couple things. So we already talked about household measurements, converting between systems. We talked about metric unit conversions. We talked about intake calculation. I gave you one question, but a second question will look exactly the same. So now the next thing is to look at is oral medications. So there are 6 questions that you'll see that are considered the oral medications. So let's talk about oral medications. So I don't know what your background is, but I know that at Allegheny campus, a lot of times those students do not get the like a lot of times this is the first time looking at drug labels, or at least seeing them a little bit more, like and being asked questions about them. So everyone, I know everyone's a little bit different about that, but I'll just explain it to you like I would explain it to them, as if you had never seen it before, but I'll be brief. And if there's something that I say, or when we go over and you're like, wait a second, what about this? Then, just ask away. And as far as asking, you can just unmute yourself, you can raise your hand, or you can just type into the chat. Any of those avenues are perfectly fine with me. Okay. So the first thing we want to look at when we're looking at our drug labels is we want to just be kind of familiar with some of the things associated with our label. So first of all, usually the name is going to be easily known. So this is Xanax, and then you can see that Xanax is the brand name. The generic is the alprazolam. So sometimes you'll see an order for the brand or the generic, and then a lot of times it's the insurance company that dictates what the patient's allowed to receive. Okay. Or it's also might just be what's available. All right. The other thing that's important is when we're looking at these labels is you want to know what these are. So it tells you it's a tablet, and it tells you that the whole bottle contains 100 tablets. Okay. So it's important to know that, because I know at Boyce, they're not going to say, how many tablets would you give? They're going to say, how much medication will the patient receive in one dose? You need to know, is it tablets? Is it capsules? Is it milliliters? Whatever that happens to be, you need to know what that is. And hopefully I'll be able to help you with that if you struggle with that. So The other thing that is usually very clear on a drug label is the strength of the medication. So what this means is that for each Xanax tablet, so one tablet, it equals 0.25 milligrams. Again, that should be, I don't know where you are as far as your drug labels, but if I don't tell you that, if I don't tell you how to look for it, then sometimes, you know, you might not know. I also take for granted, I had the luxury, I worked as a pharmacy technician for about 3.5 years when I was an undergrad. So when I look at drug labels, I know what to look for and how to read them and things like that. I know that most nursing students haven't seen a lot of these drug labels. You've seen the printed label like that you receive from the pharmacy, but now you're going to have to get familiar with these. I always recommend for added practice just to do like an image search. You can use Google, an image search for, you know, medication labels or pharmacy drug labels, and then just get an idea of what some of these things look like. I'll give you examples. I have plenty of examples posted on the practice pages that are listed. If you go into the other folders on the OneDrive folder, you'll see material for Allegheny, Boyce, North, South. There's a little bit of everything. And then I usually reuse a lot of the same images and things like that, but you might see some new ones on there. So I encourage you to look around. It's open for you to take a look at. All right. So now that we know how to look at the label, and like I said, you'll get better at this with practice, the next step is to solve it. Okay. So they give us an order, Xanax 0.75 milligrams, PO, which means by mouth or per oral, BID, which means twice a day. It then asks how much medication will the patient receive in one dose. So even though we know that BID is going to be given to them twice a day, we don't need to know that information to answer this question. We just need to know how much to administer per dose. So the first thing we want to do is we want to take our 0.75 milligrams and we want to convert this to tablets. And like we said here, this is our available, right? One tablet is 0.25 milligrams. You're going to take 0.75, divide that by 0.25, and you're going to get an answer of 3 tablets. Now, if you're doing ordered over have, this or ordered over available, this works pretty well for oral-based medications. Again, you can take that, what's ordered, the 0.75 milligrams, over the 0.25 milligrams, times your quantity, which is the 1 tablet, and you're still going to get the same answer, 3 tablets. So that's what you'd write down here, 3 tablets. I don't know if you can just write tabs, but I would just say write the full word so you don't. And the word you're getting is from the label itself. So if these were capsules, you would label it capsules. If they were caplets, you'd label them caplets. Something else that's helpful to know about tablets is that they can be scored, which means you could give somebody a half a tablet. Okay. So let's see what if the order was, let's say the order was actually for 1.25 milligrams, and we could say the same POBID. But my question is, how many tablets would I give per dose if it was 1.25 milligrams, which seems like a lot of Xanax. I don't know that that's within the safe range, but Yeah, you jumped on that real quick. The five tablets would be the correct answer. And the reason being, and like if you're doing what I think you're doing is you just take the 0.25, that times 4 would be 1 milligram, and then another 0.25, and that's the 5th tablet. So that works out. Okay. Let's look at another example. So here we have
I'm sorry, I have a question really quickly.
Oh yeah, go ahead.
So I see. I'm sorry, I don't know if I heard you earlier, but when you underline the PO, does the route matter when you're doing the conversions and stuff? Does that matter?
The only reason that would matter is when you're doing an injectable, and if you're sitting there wondering like how is the patient going to receive it, an injectable is going to tell you that it's a liquid and that it's going to be injected, right? And so you that's your clue for that it's milliliters. If it's per oral, that could be a tablet, capsule. It could also be milliliters. So it's helpful to know. You should know what it means. The root doesn't necessarily factor into your calculations, but it might factor into your understanding of how that medication is being delivered.
Okay, I understand. Thank you.
You're welcome. Good question. All right, let's look at another example. This one should be pretty straightforward. What do you guys get for if you have cephalexin 500 milligrams? You have your label there. How much would you give in one dose?
What, 250? 2 capsules.
Okay. Good. All right. Yeah. So now you might be wondering, like, are they going to be this easy? Some of them, yes. Some of them, that's what this is. It's not supposed to be like something that's going to like stump you. It's about, practicing, and getting the easy ones right. Again, if you are showing your work, which a lot of times they're going to ask you to do, you can do it one of two ways. You can do the dimensional analysis way. I don't know if they even want you to do this, but I just assume that they do. I always say this is good practice because when these problems start to get harder, like in second, third, and fourth semester, it's helpful to have a strategy that works for all types of problems, not just focusing on ordered over half, which doesn't always work later on. And if I'm doing ordered over half, I would just do 500 over 250, and that would be giving me, like you said, the 2 capsules. So I always say, usually the oral based meds, particularly the oral based meds that are tablet based, are usually pretty straightforward. Most students do really well with these, and they make sense conceptually. It's not a big reach. So, okay. What did I say? I just wanted to see if they were all oral medications, one step. Okay, so we'll also look at. This is actually an example of still a one step, but potentially could be 2-step, if depending on what the order was. But one of the things to pay attention in this is you will see in the label is marked with 2 things. 250 micrograms, that's what that's supposed to be. It's really hard to see. So that looks like this. So 250, and it's like a U G, so that's micrograms, and then or 0.25 milligrams. And what that's saying is that those are equivalent units. So if the order was in micrograms, you would use the micrograms. The order here, though, is in milligrams, so you would use the milligrams. How much would you give this patient? Remember, 3 what? Yeah, 3 tablets, right? So make sure you give it a new or a unit associated with it. And then that's where it is. If you're sitting there going like, well, how would I know? That's why you got to look at the label, right? The label tells you what to look for. At least what to call it. All right. So I don't have a label, but I have the available. It says to calculate the dosage for Valium 2.5 milligrams with Valium 5 milligram tablets available. So what would you put as your answer for number 13? Good. Now I will say, and you guys are knocking these out of the park, which is great. I will say that sometimes this is what they're looking for. Oops, I almost wrote milligrams. But sometimes they want this. So I always say, like, double check with your instructor, whomever is administering your test and grading your test. Make sure you know how they want you to administer it. I would assume that this is how they would predominantly want it, because this could easily get confused and be 2 tablets. You know, if that one got like kind of scratched out or something like that, but 0.5 is very specific. And you're not going to confuse that with 5 because there's a 0 in front of it. So, but I know at Allegheny campus, some instructors like the half 1/2. Some instructors are fine with the 0.5. I just encourage students to just make sure you know, because unfortunately I don't know the little details that, you know, could cause you problems on the test if something like that were to happen. So if you look for practice problems outside of what I've provided for you, you can always do, again, do a search, online search, a Google search, whatever your search engine of choice is. And you can always ask for, you know, oral medication, 1-step oral medication practice problems. And there's a plethora available online. And you're going to see them asked in a variety of different ways. And then you can look for tablets and capsules are usually the 2 most common for oral, like pill-based calculations. What we're going to go into next is what's called your oral-based meds, but now we're talking about oral-based meds that you would swallow, right? So these are called suspensions. So a suspension is something that you consume. And if you consume it, that means it's available as milliliters, sometimes as cc's, which is cubic centimeters, but cubic centimeters and milliliters are the exact same thing. They're a 1-to-1 ratio. So we have a question here about a medication called Aldamet, which is the brand name for methyl-dopa. It says you have what's labeled there. It tells you the order. By mouth, TID, which stands for 3 times a day. But the question says, how much medication will the patient receive in 1 dose? Now, what makes this one different is now we're not dealing with tablets or capsules. Our strength is actually going to be written with the concentration per volume because it's liquid. Okay. So the way to kind of think about this is like how I had previously wrote 1 tablet equals 250 milligrams. I'm going to do the same thing here. I'm going to say 250 milligrams of this medication is equal to 5 milliliters of this medication. So that means for every 5 milliliters or every teaspoon of this medication, they're going to receive 250 milligrams of Aldamet. Commonly used or commonly try to integrate, students will use this 473 milliliters. That just tells you how much is in the whole bottle. So you don't, that just like you wouldn't worry about 100 tablets, you know, you're not going to worry about the whole oral suspension. You just care about what the strength is. Okay. What is the strength of the medication? So if I'm solving this, I'm going to take my order. You're going to see a pattern here. I'm going to put it over 1. Okay. Then I'm going to take what I'm converting to. Now, what am I converting to? Well, first of all, I know it's by mouth. By mouth tells me it's either going to be a tablet, a capsule, or it's going to be milliliters. And what tells me what it is the label. The label has milliliters on it. Milliliters. It is a suspension, which tells me it's a liquid. If it's liquid, it'll also indicate per 5 ml. So those are all the clues of what you're looking for in this particular problem. So what I'm converting to is milliliters. What I'm trying to get rid of is milligrams. 250 milligrams, 5 ml. Then I plug that into my calculator. I'm going to take 400 times 5, which gives me 2,000, divided by 250, which gives me a dose of 8 milliliters. So the patient would receive 8 milliliters 3 times a day, about every 8 hours. If you are doing the ordered over available, ordered over have, there's something you need to keep in mind. And this is where students mess this up. Because if you have been listening, or if you've heard me, I've said it a couple times now. I always say order over have, and then I add in times the quantity. So you got to make sure you multiply by the 5 ml. If it's 1 ml, if it's 2 ml, if it's 10 ml, you always multiply by whatever that quantity is. When it's a tablet, of course, it's 1, or a capsule, of course, it's 1. But when it's a liquid, those mLs change. So sometimes it's 1, sometimes it's 5, sometimes it's 2. You just need to pay attention. Now, later on, we'll talk about the intramuscular, subcutaneous, IV calculations. They're going to be calculated pretty much exactly the same way. The only difference is how they're being administered. So the math is the same, but the the administration is different. So if you treat it as such, as like as we've been doing these previous problems, it's not any more difficult. It just looks different because it's worded different, and we'll see some examples of that soon. All right, let me see what else I have. Okay, yeah, so sometimes, well, this is just an out of place syringe, so we'll see that in just a moment. I just want to see if I had another oral based med. I don't think that I do. Okay. Let's do an injectable. I'll come back up to the other one, or these insulin ones, in just a moment. Oh, I thought I had another. Hold on one second. Let me add another question to this. I have some more practice problems. Okay, here's a good one with heparin. Give me one moment. Okay. All right. Oh, you know what? Actually, I'm going to change this to 5,000. That should work. 2,500. Oops. Give me one second. Okay, so in this, we have, we're taking this, so we're moving into the next type of dosage strategy or dosage type of problem. So on your, if you go back and you're ever looking at the blueprint, what I'm talking about now, or what are referred to as the parenteral medications. So these are your subcutaneous intramuscular routes. Again, one-step problems. We're going to set these up and solve them the exact same way that we would for the exact same way that we would for the previous problems we've been doing, the oral-based medications. We're going to do the same type of math. So the difference is now we just have a different unit. We have a different thing. They're asking you to shade in the dose after marking what the dose is. Now, when we know that it's an injectable, that's your clue that you're looking for when it asks you like to calculate the medication. That's your clue that it's milliliters. The other clue is milliliters. The other clue is milliliters. So if you're ever wondering what we're supposed to be doing, just look to see what is available. Now you might be wondering, well, you've seen units and you know that you can administer units of insulin. That is correct. And you'll see that in the sliding scale question probably the next time we get together, but I might even just show it to you now. But for this question, all we're going to do is we're going to calculate the milliliters for this injectable. So what answer do you get looking at this if you apply the same thing that we've been doing? And I usually say this at these workshops too. If you don't feel confident about your answer or don't know, but don't want to share it with everyone, you can send it to me as a DM, and I will, I won't call you out, but that way at least I know if you're struggling with it or just kind of lost, or I'll just assume that you got this. So again, if I'm setting this up, what's my order? The 25,000 units of heparin. I'm going to just do this deordered over halfway. My available is the 10,000 units of heparin. And then my quantity is the 1 milliliter. So units cancel. A little trick here. If you write these things out, 25 divided by 10 is a lot easier to type into your calculator than is 25,000 over 10,000, but it's the same thing. You do get 2.5 mil. And then I would just look for 2.5 milliliters on my syringe. And then I would just shade in my syringe better than what I'm doing. Okay.
So I have a question.
Yes.
So when we do the ATI dosage calc modules, it does allow for us to use a standard calculator. Are we going to be permitted to be able to use that on the actual exam now? Because that's my biggest thing. If we are able to use it, then I'm not worried. But I wasn't sure. I was told we had to do it without a calculator.
So that's a good question. To my knowledge, yes, you have access to a 10 key calculator that they provide you. I know that's the case at Allegheny campus. So my assumption is yes.
Okay.
So I would definitely though clarify that and find out. And if you do find out that the answer is no, please let me know that. But to my knowledge, yes, you will have, you'll be able to use a calculator.
Yeah, I just wonder because when I took my math 108, so it was like, you're not going to use a calculator in this class because once you get to like nursing, you're not allowed to use a calculator. So then I was shocked when we were doing the modules and we were able to use a calculator. So I was like, well, are we going to be able to use this during the exam? Because that would be the only thing that would make me nervous about doing this if there is some ungodly like number. And calculator and didn't like know it off the top of my head.
Sure. No, and it sounds like it was them just trying to scare you into doing better with your math, but yeah, you'll get to use a calculator.
Okay, perfect.
Yeah, and then Jazz actually confirmed that in the comments, saying that we are permitted and that Petro will be the one handing out the calculator.
Okay, thank you so much.
Oh, you're welcome. And thank you for confirming that. Now, sometimes though, they will ask you to show your work. So they do want to see that you know how to organize and put your questions together. The other benefit of doing and showing your work is that if you happen to not do well on the test and you need to retake it, it'll make it easier for me or whomever you remediate with to review with you. And so we can figure out where you went wrong and how to get you back on track. All right, so the only thing that differs with the injectables is really just the medication. That's a good question. Does anyone know if your test is a paper test? I know Allegheny campus is a Blackboard test, so I don't know what your test is like. And it's probably something that, yeah, okay, it's not on paper. Okay, yeah, so clearly I am out of date as far as that. I will tell you that your second, third, and fourth semester tests are still paper tests. So they must have just done the 110 on Blackboard for some reason still. So sometimes they'll want you to use scratch paper. Sometimes they'll collect that scratch paper and ask you to show your work. So just make sure if it doesn't matter, then that's fine. You don't need to. The other thing is with the shading, you'd probably just drop a pin or drop a point within Blackboard is probably how that will work. But it should be pretty obvious like how to do it, or it might even just be like select the correct filled syringe and it'd be like a multiple choice sort of situation. Although I will say that at least the tests that I've seen, they're not multiple choice, so I doubt that it will be. Okay, so yeah, I guess you don't need to worry about showing your work, so that's good. Let's look at insulin. So if for some reason it tells you to drop a pin, so like this question says you're going to do a mixed insulin syringe, and all you need to know how to do these is just how to add 12 and 16, right? Which gives you 28. And you would just mark 28 units, and they just want to make sure that you can read this. So each one of these is 1 unit. So 25, 26, 27, 28, 29, 30. So you would just mark or drop a pin at the 28 unit mark, depending on how they want you to do that. If they told you to shade it, then you would shade it. But I'm assuming if it's on Blackboard, they might not even ask you to do anything with syringes, or they'll have you drop like a little cursor. It'll look like a crosshair. And then it'll just say like, to mark it where that would be. Okay. The other insulin question you'll see in addition to marking a syringe will be looking at a sliding scale. Sliding scale just means you just need to be able to read data off of the scale or the chart that is provided to you. So it tells you your client is on a sliding scale, which usually means that they are receiving insulin and they're usually in a hospital setting when they're receiving that, or I guess at least in another clinical setting. They're usually not doing this on their own, at least not to my knowledge. But what you would do is you would take and look at the client's blood sugar level. So in this example, the blood sugar was 315. And so you would look at the range where that fits, the 315, and that's the 301 to 350. And then it tells you what to do. It says give them 8 units. Okay. If it were 215 milligrams per deciliter, you would administer 4 units. It's pretty straightforward as far as it's just reading the table.
So that's kind of like what we just did, because we just had our skills lab. So that was kind of just like that, like when we had to draw up or units to put the air in to grab or to get them to pull the medicine out, pretty much. So it's kind of just like that.
Sort of, but like for this, you're just marking what you're administering. I think there's a lot more value in what when you were learning how to like draw it out for the actual product. This is just, can you read the order and administer the correct amount and be able to pick that out. So if I give you 315, you're not going to tell me it's 10 units. You're not going to tell me it's 4 units. You're going to look at the table and see that it's 8 units is what you're to administer.
Okay, thank you.
You're welcome. Yeah, and the other thing, like when you were doing like your mixed insulin syringes, like in the question below, like you need to know the order, right? So you draw regular insulin up first, and then your NPH or whatever other type. I think it's usually just NPH. You would draw that up second. And then there's obviously a procedure to that where you kind of draw up air, push air into the medication or into the insulin, draw up what you need for the regular, draw up for what you need for the NPH, and then administer to the patient. So that procedural stuff, obviously you can't, it's even on a Blackboard test. Remember, we just care about the math. Some of the insulin questions is more so just about, like I said, reading a table, which is part of math, but there's nothing, you don't have to do any kind of calculations, which is good, other than basic adding if you get a question that looks like this one here. All right, let's see here. I want to look back at so we've actually talked about, and I didn't give you several examples, but I did give you some examples for the oral medications, the parenteral medications, and then we talked about insulin dosages and mixing insulin and things like that. So I think I'm also going to go ahead and talk about reconstitution, because that is a good one to kind of introduce you to and challenge you a little bit. And I think the next time we get together, I'll try and get some more practice problems put together and something fresh. That way you can look at it and see. Just so you know, just if you check the OneDrive folder periodically, that you'll see if I upload something there. And so just letting you know that. So, all right. So let me do this here. I already know the answer, and you already see some of my things circled. So this is probably the thing that gets most people, most students, when they are taking this dosage calc test, is this reconstitution problem. And there's a couple things to look out for to know that you're dealing with a reconstitution. So first of all, what is a reconstitution? A reconstitution is essentially, it's a powdered drug that gets water added to it, so it becomes active, and then it gets administered. Once you know that it's a reconstitution, and you may not know right from the beginning, there's a couple of things to pay attention to, but once you know that you're dealing with a reconstitution, that's how you know what you're administering. If it's going to be a liquid, that means it's going to be milliliters. All right. So how do we know we're dealing with a reconstitution, especially if it doesn't tell you it's a reconstitution? So a couple things to look for. So we have an order of Kefzol, 550 milligrams, IM, every 6 hours. IM means intramuscular. So my question always is, if you know it's intramuscular, you know that's an injectable, and you know you can't inject tablets and capsules unless you're trying to inflict pain on somebody, you can administer that in a liquid form. Okay, so that's clue number one, at least what you're looking for. You'll know if it's IM, if it's SC, it's milliliters. Okay, the label even says right at the top, it's for intramuscular IV use only. So that's important to know. Now, when you look at the label for reconstitution is very different than what we've talked about so far today. You'll see the typical things, and I know this isn't a great image, but you'll see Kefzol, and then you'll see the generic form of it, and then you'll see it just say 1 gram. Knowing that it's 1 gram doesn't really help us out, especially when we're looking for milliliters, because where's the 1 gram per milliliters, right? We're missing that information. So we need to find that information. So that's another way that you know you're dealing with a reconstitution, is that the label doesn't tell you what your concentration or your strength is. You have to look at the side label to find that information. So when we look at this, and I know it's small, but you should be able to blow it up like when you actually go to the actual image or this actual sheet here, this part of this practice test, or these practice questions. It says for intramuscular use, add 2.5 milliliters sterile water. So it tells you to do something. Okay. Now, obviously, this is a math test, so you're not adding any water to anything. It's just telling you what we're going to do in order to prepare the injection. Then you shake it. After doing that, it will provide an approximate volume of 3 milliliters. Again, that's important to know, but it doesn't necessarily tell us our concentration. What tells us our concentration is this very next thing in parentheses, where it says 330 milligrams per milliliter. That's what you're looking for. And every reconstitution problem is similar in what you're looking for, but it may not be exactly, it may not be very easy to find. Okay. All right. So I'm getting some answers already. So let me just work this out so I can clarify, because I know some of you are debating your rounding. So once we know what the concentration or the strength is, now I can take and I can do my calculation. 550 milligrams. I'm going to do this the dimensional analysis way. You can do it however you like. Okay. Milligrams. We know we're going to milliliters. 2 reasons. It's intramuscular. That's the main reason. And then the other reason is it is in milliliters. 330 milligrams per milliliter. So I'm just going to take my 550 divided by 330. And you're going to get an answer of 1.666666666. It's repeating. When you have a number that is greater than 1 and has like a long decimal answer, you're going to round that answer to the nearest 10th. So those of you who said 1.7 milliliters, that is the correct answer.
I have a question. So your reconstitution, what you're going to use it to conversion is always going to be in those parentheses on the side that you circled.
I would love to say yes, absolutely, but no. It just depends. So what I recommend, and I can't remember where I put those. Give me 1 second. I put together some reconstitution labels. Okay, so if you go into the general, let me just pull this up and see if it'll let me share it, and then I'll show you what I mean. All right, so this is an example of a reconstitution problem. I'm hoping you can see my image here. And it tells you, it says it's 1 gram of ampicillin. Now I got to look at the label, and I know this label isn't great. So here you have to look for, and you're going to see 250 milligrams ampicillin per milliliter. I don't know that I can annotate this. Let me see. Oh, okay. Sorry. That's not going to help me out. So it says, I don't even know if you could see the, actually, let me,
Yes, I think we can see it.
Okay. Thank you. But right here, so it's not in parentheses here, but that's what you're looking for. 250 milligrams per milliliter for that ampicillin. And then if I go to another example, and I'll just clear out my things here because we don't need to worry about that. we could see it's 500 milligrams. We're going to look at the label. It tells you what to do. And then we need to just continue looking. And you see, if we're talking about the intramuscular solution, it tells you 280 milligrams per milliliter. If there was another way that this was being administered, you might use different information. But this instance, it's in parentheses. But at the same time, you need to know to look for it, right? And that's what I'm trying to get at, is just you have to look for it. And what's helpful is just looking at the different types of reconstitution questions, labels, I should say. So on Blackboard, or not Blackboard, on the OneDrive folder, you will see a bunch of examples of that. And it's in the, it says Reconstitution RX labels is how that's labeled.
Okay, thank you. And it will always say, somewhere in there will always say like 250 milligrams per milliliter. So, and that will be what we're going to use.
Correct.
Okay.
The only time, and I'll let's see here, just because I want to make sure, because occasionally, I don't think you're gonna have to worry about this. So I'm just hesitant to say what I'm about to say, but occasionally, I'm just gonna say it anyways. Occasionally, the it just tells you what the total volume is, and it doesn't tell you what the strength is. If that were the case, what you would do is, and again, this is just kind of an aside, if we know that the total medication powder is 1 gram, so 1 gram, and I'll even we'll just say that's 1,000 milligrams. And it tells us that our approximate total volume is 3 milliliters. We could calculate the approximate concentration by doing 1,000 divided by 3, and you'd get an approximate of 333 milligrams per milliliter. It's very close to that 330 milligrams per milliliter. This is the number. The 330 is what you use. But if they, for some reason, didn't give it to you, this would be how you would find out what the strength of the medication is. And again, that would be an approximate.
Okay, thank you.
You're welcome. That might be helpful for like an ATI question or an NCLEX question. My guess is that you would not have a question like that on your test for drug calc. All right, I'm just going to delete that so that way if you come back to it, it doesn't confuse you. All right, so that's actually a good place to stop. The next step is just to kind of continue practicing more practice problems. And I'm going to see if I can get some. Do you guys have access to practice problems like on your Blackboard, or is this it?
We also have like ATI modules that we're supposed to be doing for clinicals, like dosage calculation stuff on ATI.
Okay, so you have practice on ATI.
And the medication administration, like practice ones, has like dosage calc questions also.
Okay, great.
Where at?
Medication administration on ATI, there's questions that you can do that have dosage calc, and same with PrepU.